Hi, and good afternoon, and welcome to my channel. I'm Dr. Carmen McGuinness, and on this channel we discuss relationships of all sorts and things that pertain to relationships, including the relationship that we have with ourselves, which I call the primary relationship. So today, as promised in my midweek sneak peek, we are going to discuss male sexual dysfunction. So I do want to be clear about this. First of all, just a little bit about myself. In addition to being a board-certified behavior analyst, I have a master's degree in health psychology, behavioral medicine, and this topic is something that was included in my studies. It is an important psychological health issue to have a happy sexual relationship. So, So this particular talk, I want to be clear about this, is aimed at women who are in a relationship with a man who is experiencing sexual dysfunction. The intention of the video is to discuss briefly the more commonly known medical causes of erectile dysfunction and other sexual dysfunctions, and then two, to briefly review some possible remedies. And three, and this will be the bulk of the talk, is to discuss in much more detail the less commonly talked about causes of sexual dysfunction, primarily behavioral and emotional causes. And to be clear, I do view emotions as behaviors because they stem from thoughts and they are measurable when words are involved. When we talk about our emotions, we can measure them. So it is falls within a behavioral domain. So on we go. So clearly sexual dysfunction is tremendously stressful for men who struggle with it. It can affect confidence and self-esteem, the relationship with one's partner, and can lead to decreased quality of life and depression. And in middle-aged men and seniors, it can also lead to premature aging through the psychological effects of not being able to perform. When you feel old, you get old. It's really kind of that simple. So these are very real problems. And if you are a female, as I said, this is aimed at the females who are in a relationship with a man that's struggling with this. If you are a female in a relationship with a man who's struggling with this, I'm sure you know that it's much less discussed. But there are also obvious effects to women involved with these men. It can affect our self-esteem as well because we feel like we've somehow failed. If you're married, you may wonder if your partner is no longer finding you attractive. If you're in a new relationship, you might not have a clue as to what's going on, what's wrong. You might wonder if he doesn't find you attractive, if he's involved with someone else. In either case, you may experience a sense of responsibility. I wonder if it's me. So this is a very real problem. And depending upon the nature of the dysfunction, what actually happens or doesn't happen, women involved with these men may experience a loss of self-esteem and certainly a lot of stress and anxiety. Different emotions may come up depending upon whether the problem is one of low energy for sexual activity, just appears not to be in the mood, for instance, or getting or maintaining an erection, trouble in experiencing an ejaculation, or premature ejaculation. So let's jump into the causes and what can be done about these particular problems. Some of the common medical causes of male sexual dysfunction include heart disease and narrowing of blood vessels. That's the more common one. Diabetes, high blood pressure, high cholesterol, obesity. Certainly obesity can play a huge part in this, and metabolic syndrome overall, and Parkinson's disease, which sometimes in the early stages is not easily detectable. Hormonal disorders such as thyroid conditions and testosterone deficiency, what's commonly called low T. Structural or anatomical disorders of the penis, which chances are if you're in a mature relationship, your gentleman would have been old enough for this to have been detected by now. Smoking, high alcohol consumption, and substance abuse can also participate in these sorts of disorders. Treatment for prostate cancer can cause problems, including radiation therapy to the pelvic region, and arteriosclerosis can cause problems. This is where the veins become clogged. These are the things that a thorough medical physician will investigate when a man presents with sexual dysfunction. Now, unfortunately, many doctors will just prescribe Viagra or something like it. But a good doctor will at least question and perhaps do some superficial tests to make sure that none of those disorders is participating in the problem. So some things that a doctor might not check into, and I promised you I would, in my sneak peek, that I would discuss the less commonly discussed things around this topic. So some things that a doctor might not check into are chronic dehydration, poor sleep patterns, vitamin deficiencies, and of course, depression. Depression affects everything in one's life. It's not possible to feel amorous when you feel miserable all the time. Being exhausted due to poor sleep patterns can affect one's entire life as well, including your sexual life. And I'll be doing a video on improving sleep patterns in the not too distant future. I've been planning to get that up and just haven't gotten to that topic yet. So dehydration, a little bit more about that. The body allocates limited resources to life-sustaining systems. If you're dehydrated all the time, you literally cannot produce sperm. Vitamin deficiency. The following possible deficiencies have been associated to male sexual dysfunction. Vitamin D, this one's huge, for maintenance of healthy blood vessels. And vitamin D will also help maintain normal blood pressure. Vitamin B3, which is niacin, has been implicated as a deficiency that could lead to erectile dysfunction. Folic acid to control nitric acid and blood flow in men with high cholesterol is recommended, folic acid. L-arginine, which is an amino acid found in red meats. So you can obviously increase your consumption of red meats, or you can take an L-arginine supplement. Now, nowadays, so many of us believe that red meat is evil, and it may well be. I'm not judging here, but with reduced consumption, we've also seen increased sexual dysfunction. So L-arginine supplementing might be a good idea. Some herbal remedies include ginseng, specifically Panax ginseng, which can act as an aphrodisiac, and males and females, by the way. And ginkgo biloba for energy and blood flow, and also nerve conduction. If you're feeling it, it's going to help things. Folic acid, I mentioned folic acid already, but specifically to increase, I think I already said this actually, nitric oxide with, yeah, I did, I just said that, sorry for the repetition. And then, and don't laugh at the name of this one, but it's called horny goatweed. It's a botanical known as, I'm going to try to pronounce this properly, epimedium, and it's known to improve circulation. So there are some natural ideas for maintaining the medical reasons for male sexual dysfunction. And I always recommend that people try natural remedies before they jump into some kind of a prescription. Now, let's look at some possible behavioral causes. And as I said, this will be the bulk of my presentation today because that's what I do. I'm a behavior analyst. So when I say behavioral, I refer specifically to those behaviors in which one engages that affect targeted outcomes. So let me repeat that. A behavior in which one engages that affects targeted outcomes. That's what I'm referring to here. So if your targeted outcome is to enjoy successful sexual activities with a particular partner, the following behaviors might negatively affect your outcome. So we'll just go through them one at a time and discuss each in turn. The first is arguing. In particular, when it involves physical or verbal, physical, I don't want to say assault, but, physical assault certainly is going to be an issue, but when you get physical with someone, when you're in their face, that sort of thing, or verbal insults, or aggression of any sort, arguing can be problematic to ongoing sexual relations, even after the makeup. Such behaviors can leave us feeling angry, guilty, depending on whether you were on the sending or receiving or both, or resentful. And it's difficult to become amorous while experiencing these emotions. Once spoken, it's hard to take back the effect that words have on relationships. So the next one is extramarital sex, or extra relationship sex if you're in a committed relationship but not married. These sorts of relationships have a unique power over us. They can feel quite intense. There's a certain energy that abounds when we let down our boundaries in new relationships in general. And for some, those with a more thrill-seeking personality, taboo relationships can be very intense indeed. The result is a raised expectation. It's not responsible to step out on your relationship and then step back into your own bedroom with someone you're quite used to and expect to experience the same physiological response. That's probably not going to happen. So a third thing, we're just going through those behavioral things that can affect outcome. A third is porn consumption. So this is another behavior that can really wreak havoc on a relationship and wreck the ability to perform successfully with an actual partner once you're in bed with someone and not watching porn on the internet or television. Again, expectations are raised, and the physiological response when thrill-seeking behaviors such as multiple partners and, shall we say, creative staging that occurs in porn are no longer present. They're not there in your bedroom with your partner who you have this targeted outcome to have a good sexual relationship with. So this is a problem. Porn consumption is a problem. It's becoming more and more, it's becoming thought of as an addiction. And then the fourth one is masturbation. And again, I don't judge, but over-frequent masturbation is a problem. It can interfere in normal sexual performance if the person just can't perform, if they've already had what they need and can't perform. An analogy would be that if you're always snacking, you're not going to want to sit down and eat a healthy meal or have a healthy relationship. And another consideration in both porn and masturbation is that the goal is to get off in both of those. That's it. That's the goal, to get off, not to share a sexual experience. If that's what you're used to, that's what your body is going to start to respond to, and you're going to start to no longer need to provide for a partner or want to. So I know that was all rather frank, but there it is. Now, there are also a few behaviors that you may not be engaging in, rather than things you're doing, things that you're not doing, that will improve upon sexual relations if you do engage in them. So these are pretty obvious, but they deserve mention here as well. So let me just go through those. Obvious first one is romance. Going out on dates, doing things together, saying nice things to one another, providing compliments, touch, just casual touch, holding hands, talking about your sexual plans with a voice or text, a kind of verbal foreplay. And I'll put up a link here to, I have a video called, I think it's called Sex Dates or something like that. I can't remember, but it's fun. It's one of my earlier ones. I'll put up a link for it. These behaviors all encourage natural sexual activity. And I sincerely, sincerely, sincerely hope that this has helped. I know this is a difficult topic. I'm also going to put up a link to a video I did not too long ago about lifelong lasting love. I think that's a really good one that complements this as well. So I sincerely really hope this has been helpful, and that you take it in the spirit in which it is presented, which is to help you have a happy, fulfilled life. A satisfying sexual life is an important part of happiness in general, a happy and healthy relationship in particular, and it's quite literally life-changing if you haven't had it and you suddenly find it. So with that, I will say adieu, and my midweek sneak peek should be up Wednesday, Thursday at the latest, and I look forward to seeing you then and next Sunday. Thank you for stopping by.